So I will kick it off. Hi, hello, and welcome. Thank you for joining us tonight for our medical marijuana and neurodegenerative disease webinar. We're really excited to be here. This is brought to you by the Apothecarium, and the Apothecarium was founded by a gentleman named Ryan Hudson in San Francisco in 2011, and his aim was to build a dispensary where people could really be proud to bring their parents. And our goal at the Apothecarium is to put first-time visitors at ease with a really beautiful atmosphere and a warm and welcoming environment. The Apothecarium is a full-service, award-winning medical marijuana dispensary. Our mission is to provide patients with quality medicine in a welcoming environment with empathy, education, and ongoing support. We have 3 locations in Pennsylvania, Plymouth Meeting, Lancaster, and Thorndale. And we also have 2 locations in New Jersey, one in Phillipsburg and another in Maplewood, and a soon 3rd to open in the northern region of the state later this year. So today's speakers on our webinar are Dr. Agnes Hewitt from the Zabrecky Institute of Biomedicine, which is located here in Pennsylvania, and I will let her introduce more about Zabrecky on the next slide. And then we also have Fran Markopko, who is our Director of Medical Professionals and Education for the Apothecarium in the Northeast. So with that said, thank you again for joining us. I'm going to hand it over to Dr. Aggie, who will talk a little bit about the Zabrecky Institute and neurodegenerative diseases. So thank you.
Okay, thank you. What a privilege to be here with all of you. I wish I could meet you all face to face. The Apothecarium is the cream of the crop of medical marijuana dispensaries, so it's always an honor to be asked to work with them. Zabrecky Institute, just in a couple sentences, I am a critical care hospitalist doctor from Mainline Health who decided that just giving people pills wasn't going to cure anything or to cut a degenerative process in the roots. So I went through a tremendous learning curve into integrative medicine, and most of our patients are autoimmune patients, patients with chronic diseases that Western medicine could not effectively treat. So that's all I'm going to say about the Zabrecky Institute. And medical marijuana has become one of the tools in our toolbox to really help heal people in a natural way. I often tell people when I certify them that the cannabis plant is more diverse and more potent than just about any other plant in nature. So this is just a brief depiction of the nervous system. So you could see that some of the axons and leaving the center of the nerve are intact. On the left, the ones on the right are interrupted. Those are nerves that are experiencing degeneration. So their ability to conduct a nerve signal is really damaged. What is a neurodegenerative disease? So they affect millions of people worldwide, and Alzheimer's and Parkinson's are the most common. They occur when nerve cells in the brain or peripheral nervous system, which means arms, legs outside of the brain, lose function over time and die. There are a lot of treatments that can relieve some of the symptoms, but there are no known cures for any of these neurodegenerative diseases, and there are currently very few ways to slow progression of the diseases, and they are costing the medical system billions of dollars and tremendous heartache to families, especially families who don't have the wherewithal to care for their patients. So the 4 prevalent neurodegenerative diseases that we'll discuss today are Parkinson's, Alzheimer's, MS, and muscular dystrophy. So Parkinson's disease is a disease of the central nervous system. And what we generally see in a patient who comes into a dispensary or into my office is they start with tremors. The muscles start to become very rigid, so it slows their body movements. They have very unstable walking and posture. So they're eventually wheelchair bound. The muscles of swallowing even get very stiff. They have very difficult time chewing and swallowing food. And you can imagine what plays out after that. It involves a part of the brain called the substantia nigra, which makes dopamine, and they are missing the dopamine, which is the neurotransmitter that helps the body control body movement, helps the brain control body movement. So these are the symptoms: very slow movement. You notice speech changes that are almost like someone's had a stroke. They're slow and very hard to understand. And they have a loss of smell and a lot of digestive issues. Next slide. The standard therapies: levodopa, which crosses the blood-brain barrier and is converted to dopamine, which they're missing. And these other, as Michelle continues to, these are basically the classes of drugs that are used to try to minimize the symptoms. We try to get people into movement and physical therapy to slow the progression of the disease. It cannot be cured, and you can develop a tolerance to levodopa, which leaves you with almost no medicines that can help you to convert a substance to dopamine in the brain. And exercises to improve mental function. So what is the role of cannabis in Parkinson's? Many, many studies. We are now looking at launching a large study on Parkinson's disease at Jefferson's Marcus Center for Integrative Health. When I say mitochondrial dysfunction, all you have to know is the mitochondria is the battery in every cell that allows it to work. So the batteries have run down. THC and CBD were tested independently, and they both show that they protect the nerves, so that people, after they've been on cannabis for about 3 months, we notice their tremors are gone. They're basically steady. They're moving up out of their wheelchairs. They have an improvement in REM sleep. And in REM sleep is where the brain really cleanses itself of toxins. They have an improvement in pain. And there's now a phase 2 trial studying Epidiolex, which is the pharmaceutical brand of cannabis that's used for people who have seizure disorders that no medicine can treat. So Alzheimer's disease, I mean, almost everyone has someone in their family tree who's had Alzheimer's. We are seeing a hockey stick spike in Alzheimer's disease. You can see from the healthy brain to the severe Alzheimer's diseased brain how much of the brain's cortex is gone. And if you notice the butterfly pattern in the center of the brain, that's where the hippocampus is, which stores memories. So that also is just disintegrating in the Alzheimer's brain. So it destroys memory and other important functions. The first symptoms are memory loss and confusion, but take note of this, and I'm going to talk about it later too, that Alzheimer's does not start in your 70s and 80s. It's starting in your 30s and 40s. And by the time the neurofibrillary tangles and the tau proteins have squeezed the life out of your brain cells, you're in your 70s and 80s, and now you're experiencing symptoms, but it's starting much, much younger. So we all know the symptoms. The person who keeps asking you to repeat yourself, changes in mood and personality. People with Alzheimer's can become very paranoid. They think people are stealing their money. They start wandering at night. They get confused with time and place, memory loss, and just trouble, balancing checkbooks and doing any kind of executive functioning. So again, the symptoms don't appear till you're older, but don't be, pacified by that, because it's already starting in our 30s and 40s. So most of us have genes for Alzheimer's. It's on the same chromosome as Down syndrome. So it's on the same chromosome as Down syndrome, but what turns that gene on is what epigenetics is all about. Two big contenders right now are the herbicide called Roundup or glyphosate, and the aluminum, which is in deodorants, it's in the chemtrails, it's saturating our environment. It is now the #1 toxic heavy metal in the body. You really need to go to doctors who have some kind of integrative knowledge so that they can test for these levels in your body and what damage this has already done to brain cells. Chronic Lyme disease, Epstein-Barr, a lot of these chronic inflammatory diseases can contribute, and the brain begins to build these bad proteins initially to protect itself from harm, but then it goes into overdrive and the protection mechanism becomes a destructive mechanism. So the medications, and anyone who's got a grandmom or aunt or uncle who's tried memantine will say minimally effective. People get a lot of GI side effects with these meds. The key to try to keep the Alzheimer's brain active is socialization, and they do resist. There are daycares for patients with Alzheimer's, and a lot of them will refuse to go because they have paranoia. Engage them in mental activities, and physical therapy is very important for them. Now, what's the possibility of cannabis? So a huge new study came out that showed that there are 2 bioactive molecules, not terpenes, that are present in the full spectrum of bioactive molecules in cannabis that prevent the tau protein from folding itself along the brain cells and strangulating them. So if we can continue this line of study and find that cannabis can actually prevent Alzheimer's, what a tremendous burden this would take off of the medical system and allow people to live longer with a quality of life and an active brain. We know that both THC and CBD, together or alone, can reduce inflammation in the brain, improve appetite. People have a sense of well-being. It improves their cognition. So there's a lot of work being done right now. We see that patients become less psychotic, agitated, and paranoia, are Alzheimer's patients, when they're using cannabis. And again, you have to go to the pharmacist in the dispensary to choose the strain and be guided into what to put your beloved patients on who are suffering from Alzheimer's. Very critical that you work with the pharmacist in the dispensary. Multiple sclerosis is a devastating autoimmune disease. There's no clear way to diagnose it, although there are some tests that we can use that show that it's potentially present in the body. I want to just add here very briefly that many autoimmune diseases start with a leaky gut. Stress, kills the good bacteria in your gut. And when there are holes punched through the walls of the gut, your feces and bacteria enter into the bloodstream, which should be sterile. And it induces your immune system to start attacking parts of the body, the thyroid. A lot of women have thyroid issues. In multiple sclerosis, what gets attacked is the nerves. But a lot of these autoimmune diseases begin with a gut problem. So integrative doctors specifically look for that to see what the state of the gut is in and heal that while they're working on trying to heal whatever system is being attacked in the body. In MS, it's the nervous system. So you can see the patterns of what happens. First of all, in multiple sclerosis, if you look closely, you see tiny white plaques. That is about the most diagnostic thing that we have is an MRI of the brain, which tells us that a person is suffering from the disease of MS. But eventually you can see this butterfly pattern in the center of the brain enlarging, which means vital structures, your pineal gland, which determines sleep, your hippocampus, which stores memory, your amygdala, which is your alert system. They're all being disintegrated by the process of this plaque formation, which is the brain trying to protect itself from the immune system destroying it. It's an autoimmune disease. So the symptoms usually, for a lot of people, it starts with vision loss. That happens to be the first symptom that they have, is they start to lose their vision. Everybody expresses it differently. So it's been a tough disease to diagnose because every individual starts with a different set of symptoms. But the fatigue, cognitive impairment, depression, anxiety, unstable mood, and visual changes and speech changes and inability to swallow food, those are pretty prevalent among most people with MS. Current treatments, steroids, we know this drill. The steroids are going to absolutely take you into osteoporosis at an early age. They have tremendous side effects that are there. Yes, they help with inflammation, but the side effect panel that's negative is great. Plasmapheresis is a technique where they take your entire blood and run it through a filtering system to filter out some of these errant proteins that are forming in the blood. Immune modulators lower the immune response to attack the body, but it's also then going to allow you to become more susceptible to COVID, to Lyme disease, to Epstein-Barr virus. Baclofen is used for symptom control. It helps with a little bit with muscle control. But you see, we have very few great tools for MS. So the role of cannabis is just, it's so exciting. We're seeing muscle spasms are being relieved when the CB1 receptor agonist, that means an agonist is anything that sits on the CB1 receptor. Usually it's THC, but CBD itself can bind more loosely to CB1. But THC is the main bioactive molecule, and it can inhibit the development of these immune processes. So they've done a lot of animal studies, and they find that the full spectrum cannabis extract is much more effective than CBD alone. So that means we need the THC portion of the cannabis plant and the full spectrum, which our pharmacist is going to go into a little more specifically. Muscular dystrophy is a very sad, very difficult disease. Um, when you see a muscular dystrophy patient who's advanced, they kind of look like a cerebral palsy patient. They're muscle wasting. They cannot build muscle. So that means the muscles of swallowing, the heart muscle, the muscle that the intestine is to pass food through. So muscles are involved in your stomach is a muscle, your heart is a muscle. So the inability to create smooth and striated muscle is dramatically affected with muscular dystrophy. It's very difficult to identify the muscular dystrophy patient early on. Genetic testing has been proven to shorten the time to diagnosis, and this is one disease where you do look for the genetic testing. So, I mean, this, you could spend a day on this, but you can see where the brain stem, which regulates breathing, body temperature, digestion, alertness, all this begins to deteriorate in muscular dystrophy. The cerebellum, which is in the back of the brain, coordinates you. That's where your fine muscle control is, your balance. So you're in muscular dystrophy, you see people who are really walking out of balance. Their visual perceptions are off. Their sensation of where their body is oriented in space is off. So they're huge fall victims, and have to be very carefully watched. They lose their ability to solve problems. And a lot of them end up just being on trach tubes for life because they can't breathe on their own. So Duchenne's muscular dystrophy is the most fatal common genetic disorder diagnosed in childhood. So more children under the age of 5 die of this genetic disease than any other genetic disease. Dystrophin is the molecule that's absent that promotes muscle development. So, this progressive muscle weakness leads to very serious complications, especially including the heart and lungs, the respiratory and cardiovascular system. So there is a new detection technique called the Soma scan, and I left a reference for anyone who has a loved one who's suffering from muscular dystrophy. This would be a great place to start to research where they're actually doing this. Again, the treatments, steroids to reduce inflammation, but we already know that cannabis is one of the most powerful anti-inflammatories in nature. We do a lot of physical therapy to try to build muscle strength, low impact, such as walking and swimming, help to build that muscle strength. So it's already been recognized by the state of Florida as a qualifying condition for medical marijuana. In the state of Pennsylvania, we have this big umbrella term called neurodegenerative diseases. This is a neuromuscular disease, but it does fall under that umbrella. So patients are eligible to get medical marijuana. You can imagine how painful it is to lose muscle mass. So this reduces the pain of the muscle spasms, the reduction of muscle mass. It improves sleep, again, especially REM sleep, which is your most restorative sleep. It relaxes muscles that are in spasm, and it increases appetite. So there's a huge drive in research right now to uncover the healing properties, not just the terpenes, but we're finding hundreds of bioactive molecules in cannabis that interact with each other, interact with terpenes, interact with THC, with CBD, with CBG. this plant, and I tell everybody that I certify for medical marijuana, this is the most potent, diverse plant that I've ever encountered on this planet. We know that turmeric root reduces inflammation. We know that chamomile and aloe can ease gastritis. Nothing has the extraordinary potential and wide array of effects as cannabis does. I've never encountered a plant like this. So we're just pushing forward. And with Jefferson, we're going to start to do studies that involve the pharmacists from some of the dispensaries we work with to start to study this more in depth in neurodegenerative diseases. Thank you for your time.
Thank you. And real quick, before Framar gets started, I did put it in the chat. If anybody has any questions throughout the entire program, please utilize either the chat or the Q&A for Dr. Aggie or Framar, and we will answer them at the end. So sorry about that, Framar, but please continue.
Hello, everyone. Thank you, Dr. Aggie, for all of that wonderful information. Michelle, you can advance to the next slide, please. Dr. Aggie mentioned some of these in regards to some of the symptoms of all of the neurodegenerative diseases, the four that Dr. Aggie specifically mentioned with MS, Alzheimer's, Parkinson's, and muscular dystrophy. In the dispensary, one of the questions when we're going over a consultation with patients are, what are some of your goals? What are you looking to help treat? And these are kind of the top 6 that kind of come to the surface of what patients want to treat most. And a lot of these are symptoms across multiple of these neurodegenerative diseases. So tremors, the rigidity with the muscles, nausea, anxiety and or depression, memory loss, muscle aches and spasms. We can also kind of throw in here too, sleep issues with insomnia, and also, increasing that appetite. So a lot of these things are somewhat physical in nature, such as the muscle spasms and the aching, the tremors, things like that. But other are some mental, these, as Dr. Aggie pointed out, these conditions can take a toll not only on the patient, but on the family members as well. We see a lot of anxiety, a lot of depression, things like that. So we really want to figure out and work with the patient as to, what are kind of your top 1, 2, 3 things that you want to treat. As we mentioned, there are no cures for these conditions. We mostly want to treat the symptoms, make patients as comfortable as possible when they're going through all of these things, depending on at what point they are in their disease, if it's in the beginning stages or farther in. They're going to have different levels of some of these issues and some of these symptoms that are going on. So cannabis can really help with all of these different symptoms that patients are facing. So next, I'm going to kind of go in and break down different aspects of the cannabis plant. So first, we talk about the cannabinoids. I picked out 3 that we usually are going to be the most prevalent to work with for these conditions. Dr. Aggie had mentioned THC. THC works on that CB1 receptor. It's going to be great for stress, and it's great for depression. It's great for muscle pains and aches and those muscle spasms. It's also really great to help increase appetite, and it's really great to help decrease nausea. So they're going to help THC at various levels, is going to help with pain. It's also going to help with sleep. So it's a great overall trying to hit multiple symptoms all at the same time. CBD is going to be great for reducing anxiety, and it's also wonderful for reducing inflammation that comes about. One of the common themes that Dr. Aggie talked about through, through her lecture is inflammation. All of these conditions cause inflammation. they start to, the nerves start to degenerate, and that inflammation that's happening does not allow anything in the body to kind of start to heal itself, because all of that inflammation is just clouding everything and kind of clamping down. So CBD is great to reduce that inflammation that's going on that occurs with all of these conditions. CBC is another very interesting cannabinoid in that it is found to help regenerate some of those nerves that are basically breaking down, which is fantastic. Problem is Dr. Aggie kind of mentioned, that inflammation's going down. So if we can kind of reduce that inflammation and then have something on board like CBC that's going to help with that regeneration of those nerves, we can maybe start, turning back the hands of time a little bit and buying a little bit more time, so decreasing the progression of the disease. So depending on what you're looking for in terms of symptom treatment, choosing products with different levels of specific cannabinoids is something that to look for, which as pharmacists in the dispensary, that's what we can help you find, those particular products for specific symptoms that you're looking for. And we always try to, start with a basis of the cannabinoids and how much of each we need to do as we're kind of, figuring out what product is going to work best. Next we have is going to be terpenes. I always say terpenes are kind of my favorite topic when talking about cannabis, because I find them very fascinating. So I picked 5 in reference to a lot of the symptoms from these conditions. Limonene is going to be great to reduce anxiety. It's going to provide a more uplifting mood. So it's going to be great for depression-like symptoms. Since it's more of an uplifting terpene, it's going to, kind of help and give that boost when it comes to fatigue. A lot of these conditions, they're very draining, they're very taxing on the body. So patients are going to get a lot of fatigue throughout the day and throughout the weeks. That's just the body doesn't really have a chance to kind of regroup and come back, because it's just these conditions are so draining on the body. Linalool I have next. Linalool I always find very fascinating because it can help with pain. It helps with muscle spasms. It's very, it's relaxing. So it's going to help with stress and anxiety. A lot of people don't know. So linalool, more lower doses, is going to be relaxing. And if you have products that have linalool in a more higher percentage, it's going to be sedating. So it's going to then help with sleep and things like that. Which brings me to myrcene. Myrcene is the most sedative terpene that the cannabis plant produces. So obviously with that sedation is going to help with sleep and insomnia at night. Also going to help with stress and anxiety because it's going to have a calming effect. It's going to help with all different kinds of pain, whether it's muscular pain or nerve type pain, because it's going to relax all of those muscles that are having all of those issues, which is going to be great for a lot of these symptoms from these conditions. Terpinolene is another great terpene. Terpinolene is a great analgesic, which means it's really great for helping and reducing pain. So whether that's pain from nerve damage and neuropathy type symptoms, or pain from muscle and spasming and aching and just that rigidity from the muscles and that tightness, it's going to help with all of that. Caryophyllene, a lot of us know is great not only for pain, but it's great for reducing inflammation. So when you have caryophyllene combined with some of the terpenes on the previous slide, once again, we are trying to reduce that inflammation that's in the body that's causing a lot of these problems. So sometimes, we're looking for 1, 2, 3, maybe a 4 type combination of a terpene profile in a product to help the patient, depending on what their goals are and what symptoms they're looking to treat. So we're going to look specifically for products that have specific terpene profiles, because we know certain terpenes in combination, we know what result we're going to get from that. So we kind of, hit it each time out of the ballpark when we're finding the right product for patient based on their goals. And that brings us then to, the different forms of consumption. How do we want to consume our medicine? What are we comfortable doing? Are we comfortable inhaling? Are we not uncomfortable, inhaling? I always am a big fan of layering products, short acting and long acting. So more short acting for exacerbations and more long acting for maintenance. Your maintenance type of medications are going to be anything that you're going to swallow, and it's going to get metabolized and broken down through your gut. So that's going to be, your capsules, your tablets, solutions, which, just a little tip, a solution is just a tincture that is swallowed. So kind of very interesting there. RSO and distillate syringes. These are going to be more concentrated forms that you can consume orally. Onset with any of these medications that are taken orally and then absorbed through the gut can take anywhere from 30 minutes to 2 hours. Sometimes it'll take up to 3 hours before they start working. It just all depends on the patient. Taking these maintenance type long-acting forms of consumption with a fatty snack, like a spoonful of peanut butter, some avocado if you want to keep with good fat, Nutella if you want a nice tasty fat, is going to help increase the absorption of these particular medications that are going to get absorbed through your gut. You can take all of them on an empty stomach, but you're going to lose anywhere from 10 to 30% of that absorption. So we always recommend that you take it with some sort of fatty snack. And the snack does not have to be big. It can be a spoonful of peanut butter on a cracker. That works perfect. You also have to watch, if you're taking the capsule and then eating dinner or eating lunch, the absorption is going to take a little bit longer, and it might be a little bit inconsistent because it's going to get mixed in with that food in the gut. So depending on how long that's going to kind of move through your system and get absorbed, you might have a little bit of kind of inaccuracy with that absorption from these types of products. So you just kind of have to little trial and error a little bit and see what your happy medium is of how much food to take versus how long it's going to take to kick in. And then that brings us to the short acting forms of consumption, which are going to be, your inhaled products, whether that is cannabis in its natural state, which is going to be that flower or that bud, or something like a vape cartridge or a non-activated concentrate that you're going to inhale. Not everybody likes to inhale, and that is perfectly fine, which is why we have tinctures available that are going to go under the tongue and get absorbed sublingually with those blood vessels that are under the tongue. So when you're inhaling any type of these forms of consumption, whether it's the flower or the vape cartridge, that's the fastest way of getting medicine into the body. So you're going to start feeling effects in about 1 to 10 minutes. Those effects usually peak around 30 minutes. So about at 30 minutes, you're going to know what your results are. We always like to tell patients, when you're doing any sort of inhaled form of consumption, to do a quick 2-3 second inhalation and wait 30 minutes before you repeat. Give that medicine a chance to work and do what it's going to do before you're so quick to take another dose, because that next dose might be a little too much, and then you're going to have, some sort of side effect associated with that, and we don't want that. In terms of tinctures, under the tongue absorption takes anywhere from 15 to 30 minutes on average. You really have to be able to hold that medicine under the tongue for a couple of minutes. That's hard for a lot of people. If you just even practice with a mouthful of water and try to hold it under your tongue, my guess is you're probably not going to last much longer than 30 seconds, because it starts to get annoying after a while. So a lot of patients, they don't necessarily have the patience to kind of hold that medicine under the tongue so it can get absorbed, and then they're swallowing it, which is totally fine. It's just going to take a little bit longer to kick in. With tinctures, once they are absorbed, the effects are going to last anywhere from 3 to 4 hours, which once again is why I like to layer the different forms of consumption. Have something that's maintenance that's going to last you throughout the day. So maybe you only have to take it twice a day, morning and afternoon, and then have something for that intermittent pain or anxiety, or that muscle spasm that comes on. So you can kind of treat that as that creeps up rather quickly before it kind of gets ahead of you, and then it's, you know, past the point of no return. So layering products is always great. I didn't have topicals on here, but we can mention topicals as well. I've gotten good results from patients, especially when they're suffering from whether the muscle spasms or the rigidity that they get from some of these conditions. The topical products really allow those muscles to relax and loosen up that rigidity. And the majority of the topicals that are in the market in Pennsylvania and New Jersey, there's no systemic absorption, which means this doesn't get into the bloodstream. So no chance of getting that higher euphoric type of feeling. So you can use it as much or as little as you want throughout the day, which is nice. It's a nice alternative to ingesting something or inhaling cannabis. There is one particular grower in Pennsylvania where the topical product is systemically absorbing, which means it does get into the bloodstream. They actually produce their product. It contains 3 specific ingredients that helps that THC cross into the bloodstream. So there is one. So always make sure, depending on what you're looking for, that you're, you know, checking with a pharmacist at the dispensary or asking one of the wellness associates just to clarify, to make sure that you know what you're getting, so you don't, you know, think you're getting something that's just going to have a localized effect when you're rubbing it in, and turns out, you know, oops, it was the one that got into the bloodstream, and now we have a little, you know, high euphoric type of feeling going on that we weren't looking for, and it wasn't intended. So yeah, so layering is always a great option with not only these conditions, but a lot of the conditions that are approved for Pennsylvania and New Jersey. And that about wraps us up. I believe this is the last slide. Yes.
Thank you, Fran Mar. So if anybody has any questions, please utilize the chat or the Q&A. And I believe I did see one that came through. So let me read it here. It says, I have MS. I use medical marijuana for pain and muscle spasms. So many of the strains cause me to get migraines. Is there anything specifically in medical marijuana that causes migraines? Maybe a terpene possibly?
So good question. So I have kind of multiple possibilities for answers. It could be that there is a terpene in some of the strains that you are using that you just happen to be a little bit more sensitive to and is causing a migraine. Migraines and headaches are also a side effect of too much THC for some patients. So you might want to see if the strains that you're using and the products that you're using, if you can use a little less, if you still develop that migraine or headache type of feeling. If you're using, usually when it comes to strain specific, that's going to be something, whether it's flower or vape cartridges that are inhaled. Those just might be, and if that's the way you're consuming it, maybe try a tincture or a solution instead of inhaling. It might be the inhaling aspect for the cannabis that might also be causing the migraine. So it might be a couple of different things. It's more or less you try to, you know, you start off eliminating one or trying something else, seeing if it still causes, and move to the next to see if you can kind of narrow it down and kind of go from there.
Awesome, thank you. As you were answering that one, another one came through. Another patient who also has MS. When I get out of the chair, even after just 20 minutes, my leg muscles are really rigid for the first 30 minutes before they start relaxing. What should I be looking for?
So you could possibly do a topical product, so then your muscles wouldn't get so.
Oh, 30 seconds, they said, not 30 minutes.
Oh, okay. Oh,
I'm
30
sorry.
seconds. Oh, okay. I'm like, that's a long time, but that's okay, because that could happen. um,
Thank you for the correction.
yes, so a topical product, patients don't always like to, like I said, take anything internal sometimes. Why kind of tax your liver and kidney to break something down if you don't have to, if you can get the same result from a topical type product. That's really great, like I said, because most of them that are on the market in Pennsylvania and New Jersey don't have any systemic absorption to it. So it's more of a localized effect. So you can kind of, rub that on and see if that will help loosen up that rigidity a little bit. So you kind of minimize, that rigidity when you're getting up.
Awesome. Thank you. I don't see any more questions coming through. Dr. Aggie or Framar, or actually one just popped up. Let me see. Somebody just had mentioned, well, first of all, one person had mentioned, thank you, great job for this presentation. So thank you again, ladies. But another person asked or mentioned that they've tried the Dr. Solomon's THC rich lotion, which I believe, Framar, is systemic, does get into your bloodstream, but it didn't seem to offer them much relief. So
the Dr. Solomon's, yes, so that's by GTI. Dr. Solomon's is the one topical brand in Pennsylvania that does have systemic absorption. So it does have 3 ingredients that get it into the bloodstream. Now, if you were expecting a more systemic effect from it and you didn't get that, my suggestion is it would probably depend on where you're putting it on your body. So if you are, putting it on your back, you're going to get a more localized effect because there's no blood vessel that's going to be, kind of close to the surface on your back that medicine can then get into. Dr. Solomon's is very interesting because, you might have back pain, but you can put it on, your wrist area where you have a nice blood vessel there that is going to absorb that topical product, and then you're going to have feeling throughout your body with the effects of that, because you basically put it on an area of the skin that it's going to get more actively into a blood vessel and then give you a better systemic effect. So if you have some left, maybe try putting it on an area of skin, like I said, that it can get more to a blood vessel so it can get in systemic and maybe get you more relief. And maybe that was a little bit of the issue, or just didn't use enough as of what you tried. Because I believe each pump of the Dr. Solomon's of the THC only is 2 milligrams of THC per pump. So it might be that you need an extra pump and a half, whatever that may be, to kind of play around, to have that feeling that you're looking for to get that relief.
Wonderful. Thank you for answering. I'm going to just double check to see if we have any more. I don't see any. So Framar or Dr. Aggie, do you have any closing remarks or anything else you would like to add? Oh, actually, another one just popped up. I keep asking you that. So hold that thought. Oh, somebody's just saying great presentation. Thank you. Awesome. So any closing remarks, ladies?
I just want to say that this is only the tip of the iceberg, the research that's been done on cannabis. The possibilities are huge for a great variety of diseases, including malignancies. And Jefferson University has started a Department of Integrative Health in their medical school. So it's starting a wave in medicine of doctors looking for more natural ways to heal. And I want to keep emphasizing that there is no plant that I've ever studied in nature that has the diversity and the potency of cannabis. So the possibilities are huge. And people always say, well, why wouldn't I go to a recreational dispensary instead of a medical? You'll never get the quality of direction that you get from a pharmacist in a medical dispensary, the quality of products. And when you go to a recreational dispensary, which I'm sure will be approved at some point in Pennsylvania, you're going to be highly taxed. You're going to get flowers and edibles, but you're not going to get what you need, which is the vital information to help you heal.
And Michelle, you're muted.
I just was saying, thank you, Dr. Aggie. Well said.
And I just wanted to add, for those of you that watch this presentation and are patients and have additional questions, please feel free to reach out to our Apothecarium dispensaries. In Pennsylvania, we do have pharmacists on staff. So if you want to call or email your question, they will get back to you with an answer. We have wonderful pharmacists on staff that I've trained. They've dealt with patients with all of these conditions. If you happen to be in New Jersey doesn't require pharmacists to be in the dispensary, so we don't have anybody on site. However, on our New Jersey Apothecarium website, there is an email for Ask an MMJ Pharmacist. And if you need to ask a medical type question, please do so. That actually goes to my pharmacists that are based in our Pennsylvania dispensaries, so they will answer you. So that actually does go to a real live pharmacist. And yeah, like I said, if you have any additional questions, please reach out to our dispensaries, and our wonderful pharmacist staff will be more than happy to help, guide you and find a specific product if that's what you're looking for. If you're not having any luck where you're going, we'd be more than happy to help you.
Thank you, Frammer. And of course, my dogs are starting to bark as soon as the presentation is winding down.
Well, they waited good time.
They did. So thank you so much, everybody, for joining. We hope that you found this informative. Like Frammer said, if you have any questions, please reach out to us. It's apothecariumpa.com or apothecariumnj for New Jersey.com. And we'd be happy to answer any of your questions. So thank you, Dr. Aggie. Thank you, Frammer. And thank you, everybody, for joining. And we'll talk to you soon. We'll see you next time.
Thank you. Have a great night.
Thank you. Good night.
Bye-bye.
Bye.